start out in 2400 BC in ancient Mesopotamia. It was here where the first medical text was transcribed. A simple clay tablet with 15 prescriptions for common ailments was listed. At this point in history, virtually no information about individual persons was collected. Fast forward 1,500 years or so. Nearly every society, China, India, Egypt, Greece, were starting to record medical texts to share knowledge. The Edwin Smith Papyrus in Egypt describes 48 cases of military injuries, and the Kahun Gynecological Papyrus discusses all manner of women's health. Traditional Indian medical texts provide descriptions of what is thought to be Parkinson's disease. And the Huangdi Neijing in ancient China is still thought to be the fundamental source for Chinese medicine, even 2 millennia later. Still, much of the medical knowledge at the time is reserved for the elites, pharaohs in Egypt, emperors in China. Information on the common man is still non-existent. Let's jump ahead to the 1300s, the Renaissance, a time of enlightenment. There is more information being generated at this point in history than any time before. More and more is being understood about the human body, about medicine, and about disease. But we are starting to see this pattern emerge, where information collected and recorded is gathered only on a very small percentage of the population and usually reserved for those with money and influence. The 1500s usher an era of darkness and disarray commonly known as the Dark Ages. Much of the information gained previously is destroyed. Less emphasis is placed on the individual, and medical knowledge stagnates. Let's jump ahead now to the 1800s. The world is bigger than ever. There is more emphasis placed on the individual, and medical technology is rapidly increasing. Sir Augustus Frederick d'Este gives us our first look at a complete symptom diary, where he tracks his multiple sclerosis diagnosis for nearly 20 years, including such details as urinary incontinence, episodes of sexual dysfunction, and each of the treatments he attempts. The data in his diary is so detailed that modern-day physicians have been able to chart the progression of his disease. But Augustus was not the average person in the 1800s. His grandfather was King George III, and he lived a life of relative ease and luxury, affording him the opportunity to record his life events in great detail. Most people's lives at the time were reduced to a few characters: a record of birth and a record of death. In the early 1900s, technology is driving progress in medicine. The X-ray machine is placed in a hospital for the first time, and electrocardiogram, or EKG, is starting to be used to diagnose cardiac abnormalities. For the very first time, paper medical records start being kept. These records, along with records of birth, marriage, and death, are the data collected on individual people over their lifetime. These records are more inclusive than any time in history, but are still reserved for those with access to the modern medical system of the day. Fast forward to the 1960s. It was here where paper medical records were traded for the electronic health record. In fact, one of the very first electronic health records, the medical record, or TMR, was created right here at Duke by one of my mentors, Dr. Ed Hammond. Transforming these paper records that could be lost or destroyed into an electronic format enabled drastic growth in the field of medicine and in the care of individuals' health. The year is 1984, the year the very first TED Talk occurred. There has been an explosion of technological advancement in the field of medicine. The pulse oximeter was introduced. The MRI was approved for use in hospitals, and the personal blood glucose meter made its debut. With these technologies came more data about patient health and wellness and disease progression. Let's jump ahead to 2009, the year that I watched my very first TED Talk and made giving a TED Talk one of my life goals. We have entered the digital age and the age of the internet. I watched that first TED Talk on a brand new platform called YouTube that was started only a few years before, along with the social media giants Facebook and Twitter. In 2009, Fitbit released their very first tracker, which recorded personal step count data. This came a few years after the release of the first Garmin smartwatch in 2003, and a few years before the release of the first Apple Watch in 2015. Electronic health records are becoming commonplace thanks to the HITECH Act signed in 2009. And we are generating enormous amounts of data, approximately 3 terabytes of data per person per year. That's enough data to fill a small library. And we project massive increases in data by the year 2020. Back in 2009, we couldn't comprehend just how much growth we would see in data and accessibility to data over the next decade. In 2009, less than a quarter of the world's population was accessing the internet. In 2020, that number was well over 60%. And the amount of data generated by each person has grown exponentially since 2009. Between tracking environmental sensor data, personal health and wellness information, behavioral statistics, social media profile records, we amass nearly unimaginable amounts of data. In the healthcare field, imaging modalities have gotten better, providing us with higher resolution images with more data. Genomics and sequencing are giving us greater insights into human health. We have made incredible leaps forward in brain-machine interfaces and recording of brain activity. And personal monitoring devices like smartphones and smartwatches are giving us unprecedented amounts of data about our health and wellness. And if we take a look back, not only are we collecting more data than at any time in history, but this data is being collected on you and me, average people, something that would not have been possible at any other time in history. And this data is collected longitudinally, meaning over time. Over time, you may track your expenditures or your habits using data, but we can also track your health and wellness over time. This gives us a way to personalize medicine like never before. Using computational methods like time series analysis and machine learning, we can begin to make predictions about your health and wellness based upon this historical data over time. This digital data is giving way to a new era of medicine, digital medicine. As a digital health data scientist, I work on using this data to diagnose, monitor, and manage disease. For example, in my PhD, I've examined the feasibility of using smartwatches for prediabetes screening. Prediabetes is a disease that is severely underdiagnosed. In the US, 1 in 3 people have prediabetes, but only 1 in 10 with prediabetes even know that they have it. And prediabetes is a precursor to type 2 diabetes, one of the 10 leading causes of death. It is very important to catch prediabetes early before it progresses to type 2 diabetes. But prediabetes screening is not happening regularly enough. In a nationally representative sample, fewer than half of those who met the screening criteria set by the American Diabetes Association were actually screened. And this is not extensible for those living in remote, rural locations or for those without consistent access to healthcare. We have shown that we can use measurements from a smartwatch, like heart rate or activity data, in order to determine a person's risk for prediabetes. The main goal is to be able to deploy this technology in the 117 million wearables that currently exist in order to screen for prediabetes and alert at-risk patients so that they can get a clinical test and start managing their condition. I have had the opportunity to work on many incredible projects in digital medicine, from using mobile apps and smartwatches for child and adolescent asthma monitoring, to developing better methods for human activity recognition, which can be used in those with movement disorders or in diseases that affect movement like stroke or Parkinson's disease. Recently, I've been a part of teams using smartwatches for early detection of the flu and even COVID-19. Using these personal monitoring devices gives us a way to personalize medicine and engage people with their own health and wellness. I personally use this technology to track my own physiology while training for ultramarathons. When looking at my data, I found myself annotating it, much like Frederick d'Este did in his diary 200 years ago. As you can see, I usually start out way too fast, and you can see this large peak in heart rate. And then I clearly need to work on my hills and perhaps my fear of bees. This monitoring became even more important this past year when I was diagnosed with an autoimmune condition, making training for ultramarathons a bit more challenging. I and many others are using these personal monitoring devices to track our own health and wellness and provide greater insights into our own well-being. And this is the tip of the iceberg. While my work has focused on using personal monitoring devices for digital medicine, there is incredible potential in combining data from personal devices with electronic health records, imaging data, genomics data, and even behavioral profiles from social media in order to provide us with a comprehensive picture of our health and wellness over time. And the best part about digital medicine is that it is accessible. A majority of the world's population is now on the internet. Electronic health records are being implemented globally, and personal monitoring devices like smartphones and smartwatches are increasingly prevalent. Now, don't get me wrong, we have a long way to go. If we look at projections for the next decade, we will see that the enormous amounts of data we are generating today will be dwarfed. It is essential that all of us ensure that this data and the incredible advances in digital medicine are accessible to everyone. We need to ensure that our models are unbiased and that our methods are ethical. To this end, I have led development of the Digital Biomarker Discovery Pipeline, or DBDP, an open source platform aimed at making digital medicine more accessible and establishing best practices that are fair, equitable, and ethical. Gone are the days where you had to be an emperor or a pharaoh or the grandson of a king to have your medical data recorded and to take charge of your own health and wellness. Thank you.